what's being touted is this miraculous effectiveness of these mRNA vaccines. It's a new technology. Well, the technology has been around for quite some time, but it's new in the form of vaccines being used in humans at mass scale. It's a brand new thing. It's never been done before. And not to say that that doesn't mean that it can't be effective. And what was being touted was a 95% effectiveness of the mRNA vaccines. And for example, and he reported this in the study as well, there was a 95.1% relative risk reduction with the Pfizer vaccine. Right? That sounds amazing. For me, even when I heard, I'm like, that's remarkable. Is that real? Like that's incredible. And with the Moderna vaccine, it was a 94.1% relative risk reduction. Now, what people don't understand is that this is a relative risk reduction. This number is what would be used by clinicians, for example, in research scientists in analyzing, say, one trial versus another or something under these lab conditions. But this doesn't speak as to what happens in the real world. That number is what's called the absolute risk reduction. The relative risk reduction can, in some instances, mean nothing. But in some instances, they could mean something, but they don't mean everything. The absolute risk reduction is what your risk reduction is as an individual in the real world with this vaccine. That's the absolute risk reduction. And when Dr. Brown analyzed the absolute risk reduction, again, we'll put this up for you to see the study. The Pfizer vaccine, it didn't have a 95% absolute risk reduction. It didn't have a 50% absolute risk reduction. It didn't have a 10% absolute risk reduction. It didn't even have a 1% absolute risk reduction. It was a 0.7% risk reduction. A 0.7% absolute risk reduction for you as an individual with the Pfizer vaccine. This is real. But most people have no idea, including experts in their respective fields, physicians who are really doing their best to help and serve their patients. They have no idea about the absolute risk reduction. They don't know that number. They're out here saying, hey, guys, 95% risk reduction. It's not perfect protection, but in reality, it's far from perfect protection. And people have the right to know and be educated on the difference. And this is real. Your absolute risk reduction, that's your risk reduction as an individual when taking these vaccines. For the Moderna vaccine, it wasn't 94%. It wasn't 9%. It was a 1.1% absolute risk reduction in their vaccine trials. And numbers like this, they wouldn't have gotten approved if these were the numbers that we're basing things on, but they used the relative risk reduction. And here's the key. This wasn't a absolute risk reduction of 1.1% for severe outcomes or for death. It was a 1.1% absolute risk reduction for mild symptoms. The protective benefit in the clinical trials were not shown to reduce risk of death. It was not shown to reduce risk of severity. It was shown to reduce risk of mild symptoms. And if you dig even deeper, and I spent a tremendous amount of time actually looking through the clinical trials, oh my goodness. Even the trials themselves, they didn't incorporate people who are at the most risk in this pandemic. People with pre-existing chronic diseases, people of advanced age. They only had to have 30% of those folks in clinical trials. Most of the people in the studies were not people who are really at risk. Another way to curveball and manipulate the data. But hey, a company like Pfizer, who was convicted of criminal activity in order to pay the largest healthcare fraud settlement in the history of the Department of Justice, they wouldn't do something like that. They wouldn't accidentally omit the absolute risk reduction. They wouldn't water down the clinical trials to make it favorable for them. They wouldn't do that. Pfizer was only